This is breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
Good afternoon, everyone. I'm Jen Ah, coming to you live from the Review-Journal studio. We're about to take you live to the Grant Sawyer State Office Building, where we're expecting to hear an update on efforts to vaccinate Southern Nevada residents against COVID-19. Now, Governor Steve Sisolak and health officials are scheduled to give a press conference on the Get Out the Vaccine program. Last week, Clark County reached a significant milestone in its battle against the coronavirus. The Southern Nevada Health District announced more than 70% of Clark County residents 12 and older received at least one dose of the COVID vaccine, 70%. Officials have been pulling out all the stops in the fight against COVID. Back in July, Nevada became one of the first states in the nation to bring in surge teams from FEMA to help with the vaccination efforts. Now, it looks like the governor's press conference is just about to start here. Let's take a listen.
To help augment state efforts, the governor's team called me immediately to find out how to get more boots on the ground in our Silver State. His leadership, along with a history of partnership between the Nevada Division of Emergency Management and our federal partners in FEMA, is the reason why we are one of the first states with a surge team on the ground. At this time, I'd like to introduce Governor Steve Sisolak.
Thank you, Chief Fogerson. I appreciate that, and I'm grateful for your continued service to the state of Nevada, whether that was helping with our combating wildfires in northern Nevada or your work helping lead the COVID-19 response across the entire state. As Chief Fogerson mentioned, we officially made the request of the federal government for additional support in the form of FEMA surge teams back on July 1st. In just about 2 weeks, we had teams from FEMA on the ground in the Silver State, working closely with Chief Fogerson's team at DEM, leaders from our Department of Health and Human Services, and local partners like the Southern Nevada Health District. Together, these teams quickly identified zip codes in Southern Nevada with low vaccination rates and high rates of infection as targeted neighborhoods, leveraging partnerships with community organizations like Immunize Nevada and Mi Familia Vota. Teams immediately got to work on direct and targeted outreach in those zip codes. Since July, those teams have worked to canvass 21 separate zip codes in Southern Nevada. They've supported more than 280 outreach and vaccination events and distributed more than 300,000 pieces of literature and materials in Southern Nevada. I am so grateful to the federal government for making these FEMA teams available and accessible to our state. And I'm even more grateful to the organizations in Nevada that stepped up to help the surge teams accomplish their mission. In the last few months, in Clark County and across the state of Nevada, we have made incredible progress in our fight against COVID-19. Our case rates and positivity rates are dropping rapidly, and we are seeing more Nevadans vaccinated every single day. The efforts of FEMA and the efforts across the state of Nevada are why we are seeing this happen. Statewide, now this is statewide, our positivity rate is down to 8.5%. White Pine, Pershing, and Clark have the lowest positivity rates right now at 2.9%, 5.6%, and 6.7% respectively. Unfortunately, we have some counties that still have very high positivity rates that we need to continue to work on. Esmeralda, Elko, and Lander all have high positivity rates over 20%. That's too many Nevadans who are testing positive for COVID-19. Statewide, 63% of the eligible population 12 and older has chosen to initiate vaccination against COVID-19, and almost 55% of the eligible population over age 12 is fully vaccinated. Washoe, Carson, and Clark have the top 3 vaccination rates in the county by county, with 70%, 69%, and 63% for Clark of the population who have started the vaccination process, with Douglas not too far behind at 60%. Again, we have some counties in the state that we need to do more to educate our fellow Nevadans about the importance of vaccination. Only 21% of the residents in Story County have initiated vaccination process. Only 32% in Eureka County, and we have low rates in Lander and Lincoln as well. Please help protect yourselves, your family, your community, and our economy by getting vaccinated against COVID-19. It's a simple shot that can help keep us protected and keep our economy open. At this time, I'd like to introduce Sharon Luce, who served as incident commander for the Nevada Division of Emergency Management, to talk more about the work accomplished since July. Sharon.
Thank you, Governor Sisolak. Without your leadership, this mission could not have been a success. It was my honor to work alongside so many dedicated employees and volunteers in Southern Nevada since July to help increase our outreach and education efforts in Southern Nevada and to help connect more Nevadans to the COVID-19 vaccine. I wanted to take a few moments to highlight some of our success. We've been able to keep track of vaccination rates in zip codes that were targeted for outreach, and we've seen tremendous success. We have this information available as printouts for those in the room, and a copy of these materials will be distributed after today's events. I wanted to start with the top 4 zip codes where we saw an increase in vaccination rates. I want to briefly highlight one, but we have maps and handouts that highlight all the progress. In 89030, which is in North Las Vegas, we saw a 22% change in all doses administered and a 21% change in first doses administered. That means 21% more of the Nevadans in that zip code chose to protect themselves from COVID during this mission. We were also able to compare areas of Clark County where we did targeted outreach to areas that we did not do targeted outreach, and we saw an average difference of 2% in both all doses administered and first doses administered. We have made tremendous progress in a relatively short period of time. I again want to thank Governor Sisolak for his leadership, our state agencies, the Southern Nevada Health District, and our volunteer organizations for their hard work. At this time, I'd like to turn it over to Robert Pesapane from FEMA to say a few words.
Thank you, Sharon. I'm Robert Pesapane. I'm the Deputy Federal Coordinating Officer for the COVID-19 event here in Nevada and our larger federal region. FEMA's mission is helping people. I want to thank Governor Sisolak and Sharon Luce for sharing their details on the team effort here in Southern Nevada that led to interactions with thousands of individuals at outreach events, and thank teams of volunteers in neighborhoods that went to the canvassed areas on doorsteps. These one-on-one interactions help boost vaccination rates in areas we focused in areas. One of our bilingual volunteers shared that his first interaction with a Las Vegas resident was with someone who reminded him of his doula, his grandmother. They connected culturally and in Spanish, and she was grateful for the visit, the encouragement, and the vaccinated, and to be vaccinated, and the concern and intention to help her community. Over the course of the Get Out the Vaccine mission, there were more than 400 staff volunteers from all over the country, as well as nearly 50 local volunteers here in the Clark County area that contribute to the operation. A diverse staff with multilingual capabilities contributed to the public acceptance, made an impact in vulnerable communities, and changed local perception, and importantly, increased vaccination rates. Greater awareness and increased vaccination rates save lives. I want to give special thanks to volunteers who spent long, hot days working to make this mission succeed. Faith-based and community-based organizations delivered critical helpers. Peace Corps and AmeriCorps volunteers provided additional skill and compassion. The federal support to the state of this locally executed mission is concluding, but FEMA and federal partners remain committed to Nevada as we help work together to protect people and communities from COVID-19. At this time, I'd like to return it back over to Governor Sisolak to make a few closing remarks.
Thank you, Robert, and all your colleagues at FEMA who made Nevada their home for so long to help us in our efforts. Again, I want to express my thanks to everyone who is involved in this process. And while FEMA surge teams are ending their mission, we are still working to ensure Nevadans have access to the COVID-19 vaccine. Again, it is available, it is free, and it is effective. We're continuing to work with our local health authorities like SNHD and volunteer organizations across the state to make sure we reach Nevadans wherever they are. That includes working with the CDC Foundation to hire more support for our efforts at no cost to our state. These are CDC Foundation-funded positions who can bring more capacity and support to the state. Some of these new team members will be working hand in hand with state agencies like the Department of Health and Human Services to provide extra support and extra resources. I want to close with a reminder. Please, please get your COVID-19 vaccine if you have not already done so. If you're eligible for a booster, please get your booster shot. You can find a clinic near you at nvcovidfighter.org. Thank you very much, and I'd be happy to take a few questions if there are any.
We'll go Mary at the RJ first.
Great. Hello, Governor.
Hi, Mary.
Do you feel at this point that the worst of COVID is behind us? And do you see any point at which Nevada would impose vaccination requirements such as those that were just imposed by the city of Los Angeles?
I'm hopeful that the worst is behind us, but you never know with variants that are coming forward. I think that we've got making significant progress on the virus and as it relates to Delta, which caused our last surge. I am not anticipating any more mandates, as you're talking about in LA. I want to commend, as I gave you the figures earlier, those in the state who are helping us get the vaccination rates up and the positivity rates down, and encourage those who, again, who have not been vaccinated, if not for yourself, for your family, for your colleagues, for our economy, please get the vaccine.
Go Dana in the back, and then we'll come to James.
Hi, Governor. Do you have any grasp of vaccination rates among specific industries, for instance, construction, anything like that?
I do not. I don't know if anybody has that. I have anecdotal stories from some of the industries when I meet with them as it relates to the rates. Do we have any of that?
That's self-reported data, Dana, so we'll have some of that anecdotally. So if you want to email me, we can pull from specific industries.
I have another question. As you know, a number of correctional guards are upset about having to get vaccinations. Are you preparing for any sort of an exodus? What are your options in that situation?
It is extremely important. We have a responsibility to protect our inmates from COVID. They're in a vulnerable position in a very confined setting, as you're well aware. We tried to work with our correctional officers, and we're hopeful that they will get the vaccine when they see the benefit that it has. I mean, we hear from families that have difficulty getting in and seeing their family members that are incarcerated. And we're trying to find that balance, but it's important that we protect all of these individuals while they're under the custody of Nevada. And we're hopeful that we will have enough guards get vaccinated.
What are your options? Can you call in the National Guard if you need to?
Well, I don't want to suppose that they're not going to. My premise is that they are going to get the vaccine, and if they don't, we're going to have to take appropriate action.
We'll come over to James, and then Sasha.
Thank you, Governor. Many Nevadans have been asked about the mask mandate. Can you specifically provide an update to the mask mandate? Are we on the road to recovery in that element, or should we be expecting more options?
The mask mandate remains the same that has been in place. You've got to be under 8% for 2 weeks in a row. Now, several, as you heard, of the counties are under 8% right now, but you also have to have your case number under, I think it was 150 per 100,000 people for the weekly period. We're falling far short of that. So the only way we can get the mask mandate removed, which, believe me, no one would like to remove it more than I would be to get more people vaccinated and ultimately have fewer cases.
Are we seeing encouraging signs? You mentioned vaccines. Anything else that's an encouraging sign for?
Yeah, we're seeing a lot of encouraging signs. We're seeing our hospitalization rates are coming down. Our positive cases are coming down. which in effect is making our numbers look better. There's a lag in all of these statistics, clearly, but we're definitely on the right trajectory.
We'll go Sasha, and then I think Jacob had his hand up.
Hi, Governor.
Hi.
In terms of minority groups and low-income areas in Las Vegas, I know it's probably related to zip codes, but have there been specific, targets within this program to target specific minority groups that have lower vaccination rates, and has that been successful?
Governor, I think Sharon might have some specific information and be able to speak to some of that a little bit.
Okay, and then I'll follow up.
Or you can go first.
Sorry, Megan, I didn't want to interrupt here. We're aware that in some of our minority communities, our communities of color, there's a little more resistance or apprehension to getting the vaccine. That was one of the things that the FEMA surge teams did so well for us, is reaching into those communities and hoping to educate folks a little bit more. We're working with our faith-based communities to get that word out, and we'll continue to do so as we move forward.
So one of the maps that you see and that will be in the handouts is this SVI data of Las Vegas. And so the top 6 zip codes where we're seeing low vaccination rates were selected. And then the overlay that you're seeing is the social vulnerability index, which is measurements like racial and ethnic minorities, socioeconomic status, those kinds of things. And so the darker blue the area is, the more of those minority groups and those that are socially vulnerable are in the county. And that was the information that we were going off of. And so all of the objectives that we put out there for Get the Vaccine for our teams to do outreach were to target those areas where we were seeing those minority groups and other socioeconomic circumstances.
We'll go Jacob from the Indy.
Hi, Governor. So we just obtained a copy of a letter from Blockchain CEO Jeff Burns withdrawing the company from the Innovation Zones committees. And in it, he said that there was no state champion for the concept. Are you disappointed in this withdrawal?
Well, economic diversification continues to be a priority for me. I'm disappointed that Jeff and Blockchain chose to go in a different direction. It was a proposal that was being vetted through the committee that was formed, but Blockchains is going to make their decision, and the state, we talked about it during the last session, and we're going to wait and see. But moving forward, we're continuing our quest for economic diversification.
All right. Thank you, everyone, for coming out. We will see you at the next one.
Thanks, everybody.
I didn't mean to take it away, guys.
All right, so you just heard an update from Governor Steve Sisolak and other health officials on efforts to get more residents vaccinated against COVID-19 here in Southern Nevada. They also showed a map and explained exactly which areas are seeing great vaccination rates and vice versa, along with how many people are being exposed and have gotten COVID. Now, they also said that the FEMA surge response teams are ending their mission here in Southern Nevada. You may remember back in July, Nevada was one of the first states in the nation to welcome these surge response teams, where they canvassed neighborhoods in the hardest hit areas, and they also set up pop-up vaccine clinics as well. While the FEMA surge response teams are ending their mission, the effort to get more people vaccinated continues. We'll have much more on that and the latest vaccination numbers for you on our website, lvrj.com. You can also watch our weekday newscasts, 7 at 7 a.m. and p.m. Available on Roku, Apple TV, YouTube, all your favorite streaming platforms. Our RJ mobile app to get news alerts sent right to your phone. I'm Jen Ah. Thank you for joining us this afternoon. We'll see you in a few hours at 7.
You've been watching breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.